Hi, I'm Charlotte Derr, and I am the Program Director for the Emergency Medicine Residency Program at USF. I grew up in Sarasota, Florida, and I went to medical school at the University of South Florida. I did residency at Maricopa Medical Center in Phoenix, Arizona, where I was fortunate enough to train under faculty that had a lot of experience in point-of-care ultrasound. And it was during that time that I developed my own niche in emergency ultrasound. I was able to obtain my RDMS certification during residency, and after my training, I was looking for an academic job. As luck would have it, they were starting an emergency medicine program at the University of South Florida. So I was able to return home to the Tampa Bay area. When I interviewed for that job, they asked me to be the ultrasound director, and I thought, what an amazing opportunity to be able to get in at the ground level on a program that was just starting and to help build it from the ground up. 2 years after the residency program started, I became the assistant program director, and in 2010, I started the Emergency Ultrasound Fellowship. My entire career has been at USF and at Tampa General Hospital, and I feel very fortunate that I was surrounded by faculty who supported me and opened a lot of doors for me. I've had the opportunity to speak 11 times at the ASAP Scientific Assembly. I have taught international ultrasound courses. I've worked for the NFL for 5 years. I serve as the medical director for Gulf Coast Ultrasound Institute, and I'm also the regional ultrasound director for Team Health Southeast. Outside of medicine, wellness is really important to me, and I try to infuse a little bit of that into our residency program. I enjoy lifting weights, I'm on my Peloton, I'm out walking my dogs, and my husband and I enjoy adventure travel. We go snowboarding every year. We've been rappelling down Table Mountain in South Africa, whitewater rafting down the Zambezi River. We've gone mountain biking at North Star at Tahoe. But when we're not doing adrenaline activities, then we try to go golfing. And I'm just now learning to golf, and I am terrible at it. If it's a rainy day in Tampa, I stay inside and I paint. I love acrylic painting, and right now I am practicing acrylic pouring. I truly believe we have one of the best programs in the country for training residents for real-world emergency medicine. We are a high acuity, high volume, level 1 trauma center for both adults and pediatrics. In addition, we are a burn center, a transplant center, and a major referral center for the West Coast of Florida. We have a very diverse patient population in terms of race, ethnicity, and socioeconomic class. We are located on Davis Island, one of the most affluent areas of Tampa. And we receive those community-type patients whose private doctors come to Tampa General Hospital and see their patients at Tampa General. But we also serve as the safety net hospital for the Tampa Bay region. So if a patient is turned away at another facility, they know they can come to Tampa General Hospital to receive care. But on top of that, we're also associated with the Morsani College of Medicine. In fact, we are their main teaching hospital, and that brings with it a very academic feel to Tampa General Hospital. There are several unique things about the curriculum of this residency program. First, you start seeing sick patients immediately. I truly believe it's important for a resident to have 3 full years of critical care experience. So every day that you're working in the pod in the emergency department, you will also be managing sick patients in our critical care area. The complexity of our patients leads to great across-the-desk teaching and collaboration with a very team-like atmosphere. Several of our off-service rotations are emergency department-based, and this is due to the residents' feedback. As an example, when our residents rotate on trauma, of course they respond to the trauma alerts and the trauma activations, but rather than being upstairs, writing discharge summaries, managing I's and O's, they're down seeing acute surgical issues as well. We really think that's much more pertinent to their career as an emergency physician. On orthopedics, it's very similar. It's emergency department paced. We don't want you in the operating room holding a retractor for 4 to 6 hours or going to another program's follow-up clinic. We want you in the ED doing acute orthopedic procedures, reducing shoulders, taking care of an ankle fracture dislocation, managing compartment syndromes. Our residents also have the ability to do either a selective or an elective during each of their PGY years. And I think this is really important. This allows the resident to develop their niche within emergency medicine, explore fellowship options, or simply round out their own education. We embrace change, and we are always looking for ways to improve this program. I ask the residents to be the best that they can be and we will provide the structure and the support to make them the best emergency physician possible. And they know that along the way, we will be there to listen to their ideas because we too want to evolve as a program.